Hi, everyone. I'm Dr. Miriam Smith, DNP, and today I just want to welcome you to the Empowering New Nurses show. I'm excited again that you are here, and thanks for the support that you have been given to me and to others, the young nurses. So today we'll be talking about one of the skills that we should ensure that is done properly. And do you want to guess what that one is or this one is? Okay, while you're thinking, it is definitely the proper or the right way of inserting a urinary catheter. So this time I'll talk about just the insertion of it, the proper way. My next series or my next episode will definitely be about the maintenance. So just remember that today we're talking about the proper insertion of urinary catheter. So first of all, I know you got all your stuff that you're going to be using, prepare for it. But at this point, we're going to be talking about first, we're going to do proper hygiene, proper hand hygiene before and after the insertion. Yes, it's important. We're going to be inserting the catheter with an aseptic technique, also with the right instruments. You're going to have the right size catheter for your patient. And there is something very, very important. You must indicate, there must be documented the reason for this catheter, whether it's for urinary retention, whatever the cause is. And that's a doctor's order. I remember the time when it used to be inserted, but now it has to be ordered. Okay. So you're going to document the indication for it. And you're going to put the time when it's inserted, the date, also the person who inserts it, because we're making sure that the patient is safe. We're making sure that we are preventing CAUTI, as we would say, that is catheter-associated urinary tract infection. Some patients go to the hospital and they end up with that. So we want to make sure that you have done your part in making sure that this doesn't happen. Okay, by adhering to these key points, that patient should be okay. And you are going to be an advocate for that patient. If the patient does not need the catheter, when you're going on rounds or you're talking to your doctor, you're talking to the team, and there's no need for that, then it should be removed. So it's important to make sure that you know all about this and make sure you know the policy that goes with that. All right, because sometimes, although the indication somewhere else, say for example, CDC might say something is okay, but with the policy for your hospital, it doesn't go by that. It doesn't. That, for example, a patient might be using it in bed for a long time. No, that's for that particular hospital or that facility. They want it to be not to be. And one of the indicators. So make sure you know where you are. And especially if you moonlight also, remember that different policies are for different hospitals or different health institutions. So I'm Dr. Miriam Smith. I'm your host, and I welcome you again to the Empowering New Nurses show. Now, you can get me on YouTube at Miriam Amanda Smith. You can also find me on Podcast Mirror, an Apple podcast, Spotify. Yes, I'm on those, Facebook, Instagram. So it was a pleasure to have you today. You have to tell somebody else about this Empowering New Nurses show. The book will be coming out, Empowering New Guide for Empowering New Nurses. I know you have been doing well, and we just continue to just embrace this noble profession as you continue. All right. Have a great day and be blessed.